Well, I was born in Eston, Saskatchewan. It's a farming community. Maximum population would be 1,200, probably about 800 now. And my parents were both immigrants to Canada. My father from Holland and my mother from Scotland. I think the single most motivating thing in this small town was the family doctor. He was my idol or my hero. One day when boys were being boys, we went to an old farm machinery lot. We started up a tractor with a fan belt on it, and my friend got his fingers in the fan belt and cut off 4 fingers. And naturally we were in a fair bit of trouble over that. But the family doctor rescued. He did everything, and I somehow got to know him very well and admired him, and I guess that's probably the reason why I went into medicine. There's not much to do in Eston, Saskatchewan, so most of my life was spent playing hockey. I played amateur hockey at every level, right to juvenile, and we won the Saskatchewan championship. You can imagine, from this little town. I, of course, much to my mother's dismay, thought I would quit school and become a junior hockey star and eventually get play in the NHL. And he just said, "Look, you're never not going to be that level. You better keep going to school." So I did, and I went to the University of Saskatchewan. Just by chance, as a visiting speaker for our graduation was Dr. H. Rock Robertson, who was the newly appointed chair of surgery at the Montreal General Hospital. And at the graduation banquet, I had a chance to sit beside him. And he asked me what I wanted to do when I grew up. I said, "I want to be a surgeon." And he said, "Well, why don't you come to the Montreal General?" I said, "Well, I didn't apply there. I didn't put my..." "Oh," he said, "that's okay. If you'll accept my handshake, you come a year from now on July 1st and you'll have a job." So I came to the Montreal General on his handshake, and it was the best move that I've ever made. And his idea was that the most important thing about the trauma patient is the time from injury to definitive care. In the US, they call it the golden hour. When we looked at our results compared to the US results, and this was probably 10 years after I'd been in practice, we found that our mortality rate for equivalent level of injury was 50%, and theirs was about 8 or 10%. Well, that means that if you have a certain magnitude of injury, and that means, say, a big car crash or a gunshot wound to the abdomen or to the chest, with that severity of injury, in Quebec, 50% of the patients died, 1 out of 2. When I first came here, we had an emergency room, and we had a place where if you were a little sicker, we could move you there. Over the years, we developed a surgical ICU, which is all part of the trauma treatment program. Our chances of surviving today versus the old system are, there's been an enormous reduction in mortality rate. Time from injury to definitive care is the secret to good trauma care and to survival.
This is the place that everybody comes to for a large area when you're in real trouble after a major trauma event. It's a go place. It's 24/7, 365. The service we're supposed to provide here to the community to deal with major trauma events, unfortunately, this is a huge public health problem. It's the #1 cause of death for everyone in our society under the age of 45.
Trauma depends on people. And I guess what I'm proudest of are the young people that we've got with us now, Dr. Razik, Dr. Deckelbaum, Dr. Fata.
We see, on average, around 9,000 to 10,000 trauma patients a year in this emergency department. and about 2,500 of those are more severe cases that would activate our trauma team to come and support the emergency department team, who are part of the trauma team, and we work together to organize that. Between 700 and 800 of those patients would be the highest category, the extreme threat to life that those people would have suffered in whatever event has occurred. So that's more than 1 to 2 patients per day who have who show up here with a severe threat to their life that requires a very orchestrated response, a very sophisticated high-level expertise, teams, and equipment in order to prevent that person from having a worse outcome than they would otherwise have if they couldn't access the kind of teams that they're going to get in this building.
Dawson shooting, if you remember, at that time we had, I think, 13 or 14 very serious injuries, gunshot wounds. We did 6 or 8 operations that evening, so that we have a trauma room which is as good or as equivalent to any of the top-notch trauma centers in the U.S. In terms of people, we've got the most amazing trauma team going.
Remember the day of the Dawson shootings. That is a day that obviously we all remember very well. It was a difficult day. I remember standing there with one of the other emergency department trauma team leaders, Bruno Bernardin, and we both, looked at each other and were like, well, here we go. We're being called upon now, and let's just hope we can pull this off and do as well as I hope we can do. First person I saw right away, the first patients had just come into the trauma bay. They had severe wounds. We knew we were going to have to, there were more coming. Dr. Mulder, all of a sudden, is just standing next to me. And I remember looking at him, and I remember him looking at me, and I remember him asking in as calm a tone of voice you could possibly imagine, may I be of some assistance? And immediately, I just looked at him and I realized, we're gonna be okay.
My relationship with the Montreal Canadiens hockey team has really been an avocation. It's not a job. It's something that I love and I enjoy every day.
15.8 seconds to go.
Max Pacioretty was, we were sitting in our usual seats right behind the bench, and right in front of us, he was skating by and tried to avoid a check from Sedino Chera. The elbow pushed his head into the stanchion, and he went down like a stone and was laying flat on his abdomen.
It's down face first as Chara angled him, and Pacioretty was lined up against the center.
We did the appropriate pre-trauma assessment and took him to the hospital, where the trauma center took over and treated him magnificently.
When I first met Dr. Mulder, it was obvious that he had a lot of experience with different injuries, but more importantly, I think it was important that how good he was understanding the individual, and I think that goes a long way with the players and the patients, and I think it makes you trust him more in doing his job. I've had nothing but great experiences when I went to the Montreal General, and it seems like every time I was there, it was overseen by Dr. Mulder. His name definitely carries a lot of weight there. A big reason for my foundation was because of my respect for Dr. Mulder and everything he had done for me in the past. And he's not just in the hospital working hard and saving lives and getting people healthy, but he's also a big part of raising money there, and he puts a lot of effort into that as well, and it was really nice to see, and I think it motivated me to step up and help out as well.
Trauma has been the focus or the center of my career. I've been involved with all the trauma organizations in Canada, or in Quebec, Canada, USA, internationally. I started the one in the South America, so I've been involved with trauma. It's been the academic focus of my career. We think about cancer, and we think about strokes, and we think about heart disease. The commonest cause of death in Canada up until the age of 44 is trauma, injury. I'm very proud of the fact that we've got a trauma center that could compete with any in North America. And to think they would name it is an incredible honor. One of the medical students said to me the other day, he said, "You have the absolute dream job." He said, "You're a thoracic surgeon, in the daytime and you look after the Montreal Canadiens at night, and he couldn't have said it better.